Good morning, everyone. I'm Robin Shapiro. I'm the board chair of the Washington State Health Advocacy Association. We are recording this community conversation. We're delighted that you are joining us today. And we have some very special speakers who I will introduce in a moment. But I just wanted to say that the community conversations are brought to you by WASHA, the Washington State Health Advocacy Association. We're a not-for-profit organization dedicated to promoting health advocacy in our state, empowering people, and improving health. We seek to revolutionize how people view their health by transforming patients into empowered and active partners in their health. We are recording this event today, so please don't use your video or audio if you don't wish to be part of this recorded presentation, which we will be making available to the public. We are already recording. Please use the chat function to ask questions. You can raise your hand or privately send me a chat if you'd like to unmute and speak. We are expecting over 110 people to participate today, so thank you so much for joining us and participating in this live event. So with that, I would like to introduce our speakers and set some expectations for today. Navigating mental health is a very, very big topic, and we will just have 1 hour together today, maybe even a little bit less. So what I hope we accomplish today is, number one, give you a little bit of an update on the COVID-19 situation and what's happening in our community. And we're very lucky to have Dale Reisner, doctor and medical director of OBGYN quality and safety at Swedish Health Services, and a WASHA board member who will do that brief update. And then we're joined by two other professionals, Veronika Zantop, who is a doctor, psychiatric hospitalist, and medical director of women's wellness at Swedish Medical Center in Seattle. She's going to be highlighting just some basic mental health issues. This could be days and days and months of content in and of itself, but she's going to just give some highlights as to what is happening right now. Then we're also joined by Alexandra Fleming, or Lexi, who is a licensed mental health therapist from Swedish, and she's going to share with us some top coping skills. So by the time that we leave today, what our hope is that we're able to address some mental health issues and also give you some very specific skills to help you and your clients walk away from. So with that, I'd like to turn it over to Dr. Dale Reisner. Dale?
Good morning, everybody. It's great to be back. I've had the great privilege of helping with some of these community presentations, and today I'm going to take just a little bit of time to talk about where we're at, what the current status is of the COVID situation in Washington State specifically, and just wanted to kind of remind everybody that it's been not even a month since everything was shut down. It feels like it's been forever. And hopefully Veronika and Lexi will help us with why that feels like it's forever. You know, the businesses and schools closed the middle of March, so it's been a little more than that. Than a month for those. The other services in the stay-at-home order are just about a month now. So consistent in conjunction with that, we have seen a flattening of the curve of the COVID-19 cases. The death rate has come down in terms of the number of people dying per day. And we've gone from 41 at our peak on April the 6th to what is predicted to be about 9 as of today. The latest data we have is from last Tuesday, so it's not up to date. They're updating it about once a week now as things have slowed down. So that's all obviously really good news. there are a number of people making predictions, and the thought is that we will have hopefully 0 deaths from COVID by either the 3rd or 4th week of May. So that is really promising, and it really speaks to what we have been doing with what is typically called social distancing. And one of the psychiatrists, not Veronika, but one of our other psychiatrists said, we shouldn't be calling it social distancing. We should be calling it physical distancing because we have to tend to our social needs as well. The other thing I wanted to mention is antibody testing. So the 3 things we really need to get out from under this totally is a vaccine. People are working around the world on creating a vaccine. It is not easy. Do not expect a vaccine before 2021. And we'll be lucky if it's the first quarter of 2021, but usually it takes anywhere from 12 months to 18 months to make a new vaccine, and this is a challenging thing to do. So that's the longest thing that we will have. We need expanded testing so that we can test every single contact and good public health tracking of contacts. We're not super close on that in Washington State. So that is one of the things that, despite our rates going down, that will frustrate us all, is that we're really not quite ready to dramatically change what our distancing is. And then the third thing that would help us is antibodies. So if we haven't been infected and we were not having any symptoms, or we were mildly symptomatic, like we thought we had a cold, we may still have had COVID-19, and we may have produced some antibodies that would help us fight the infection, at least in the near future. We don't know the effectiveness of the antibodies that our bodies are producing against this particular coronavirus, and we don't know the longevity of those antibodies. We have some of that antibody testing available. However, it appears that it's probably also picking up the common cold, which is a coronavirus as well. So lots of refining that needs to be done yet. It's not quite ready for prime time, but that would be the first thing, I think, in our step to move ahead for reassurance of who's been infected, who might have protection, and we'll go from there. So I want to turn the rest of it over to our experts that are here on the call today, and I'll be available for questions at the end.
And I just want to thank Dale. She's been so generous with her time and leading these community conversations. So thank you, Dale, for giving us that perspective. And may I just re-clarify something that you said? I want to make sure that I heard it. Sure. You said that we could be in Washington State at 0 new deaths the 3rd week in May. Is that what I heard?
3rd or 4th week, yeah, somewhere around a month from now is what the predictions are, which would be awesome. And I think it will be very interesting to see what our rates are. They'll put those up tomorrow. If we've had a little spike, of course, that would alter that expected date. But if we're on the same trajectory or close to it, we can look to that as a really big plus. Yeah.
Fantastic. Thank you. Thanks for sharing that update. And I just wanted to remind people that you can put your questions in the chat function. I sent a message around to everyone. And I don't want to spend any more time before we get on to Dr. Zantop's presentation. So Veronika.
Thank you very much. It's great to see everyone's face. I saw someone had a goat in the picture as well. I love that. So this is like love in the time of cholera, but we're going to talk about anxiety in the time of corona and other mental health issues. And I'm talking together with Lexi Fleming. We work together at Swedish. And one thing that we talk about quite a bit with our patients with anxiety is that anxiety is a normal response to life. If you're having anxiety right now, that's very, very normal. And so I just want to stress that humans are wired for anxiety. So this is how we evolved over millennia. It's how we are able to avoid danger. It's how we're able to stay safe. And in short, it's how we've been able to survive as a species. So no anxiety would mean that none of us would be around today. So anxiety is good. Even if you're not an anxious person, typically, it is very common to feel or experience anxiety during times of change or times of uncertainty. This is a time of collective uncertainty. People start to have anxiety when their routines are disrupted, when things become unpredictable, and when things have been turned on their head, essentially, which is what has happened now. And it's not only the absence of routine and predictability, it's also feeling like you are not able to control your environment, that your environment is controlling you. And it's that sense of uncertainty, that sense of just lack of efficacy, lack of control that creates the most anxiety. So we're going to talk about that today. In the absence of routine and predictability, there tends to be fear and panic. So the uncertainty about the coronavirus is the hardest thing to handle. And as Dale mentioned, there are a lot of things we still don't know about the virus and testing, when we can go back to work, when it's going to be safe, how bad things might get. This makes it very, very easy to catastrophize. So to imagine the worst case scenario, and to spiral out into overwhelming dread and panic. So if anyone has felt kind of overwhelming dread and panic, that's also very normal, very much to be expected in this situation. When our bodies start to experience these thoughts, essentially, our system is flooded with stress hormones. These stress hormones are meant to help us with our fight or flight response. So your body's flooded with cortisol, with epinephrine, and ideally, you know, if you see a saber tooth, you would run away from it. Unfortunately, with the virus, we're not able to run away from it. In fact, the very opposite is true, that we're, you know, in kind of sheltering in place, not running around in place, although that helps. And Lexi's going to talk about that the running aspect of it. So additionally, there are factors specific to corona that can make anxiety and depression worse. We're isolated from others, and they know that connecting with other people is very protective against anxiety and depression. And a lot of people are engaging in coping mechanisms that make things worse. For example, Googling, trying to get reassurance from sites where they shouldn't, you know, talking to other people about things that they've heard, drinking alcohol or using other substances, also to cope. So all those things actually can make anxiety worse. It's important, again, to remember that at times anxiety can be helpful. So secondary to anxiety, we are doing things like washing our hands or staying away from others, which are very protective. So that's great. If we weren't feeling anxious, this would be a lot worse. So keep that in mind. Unfortunately, sometimes anxiety can be unhelpful. And again, that's when you start to Google too much, or excessive anxiety. I wanted to go through a list of things that people might be experiencing in the context of anxiety. So fatigue is a very common symptom of anxiety. Feeling restless, kind of on edge, having chest pain or other physical symptoms. Not being able to focus is very, very common. Feeling irritable. And we hear, Lexi and I hear that all the time. I mean, I think people are more prone to irritability with anxiety. And then a lot of you have your children at home or your partners at home. Very irritability inducing. Sleeping difficulties, incredibly common. And they found that people are at higher risk of nightmares and very vivid dreams during times of extreme anxiety. And then other things like muscle aches as well. So if you find that you have muscle tension, neck pain, back pain, very common symptoms of anxiety. Some people have panic attacks, and those are short periods where your heart rate goes up, your chest gets very tight, you have a sense of doom or overwhelm, and those can hit you out of the blue. They are related to underlying stress, but not to specific stressors, so those are also quite common. And then if you have existing depression or anxiety, you can expect that those symptoms are going to get worse during these times as well. Anxiety sometimes leads to depression, or people can have depression as well. Again, changes in appetite, feeling low energy, having low mood, not enjoying things that you would, Concentration difficulties, very common. Irritability, very common. And then feeling helpless or hopeless is also quite common. In general, the antidote to anxiety is routine, structure, consistency, and predictability. You want to make sure that you don't stoke the fear, so it gets to a point where it starts to feel paralyzing rather than helpful. And so I have a short list of things that can help, very general, and then I'm going to let Lexi take over to talk about very specific things that you can do to help with this anxiety. Channeling anxiety into action, again, using all the stress hormones to do something, to exercise, to make a plan, you know, as long as it's not overwhelming is good. Limiting your media is really, really important. So even though we feel like Googling things, checking the latest reports, reading everything we can about Corona should decrease our anxiety, it typically increases anxiety. So just depending on a couple of sources, well-trusted sources like the CDC, et cetera, is plenty. Cutting down on behaviors that you notice are fueling your anxiety. So being very aware of how you're feeling. And if something starts to rev up your anxiety, like, you know, accessing the media or talking to particular people about it, or, you know, anything that you notice is increasing your anxiety, just to be aware of that and try not to give that, to try to back off from that. If you notice that you're having a lot of negative thoughts, not giving them power. So not engaging with them. And Lexi will probably talk about that a bit more. Staying focused on the here and now. So really trying to rein in your brain from, you know, all these thoughts about what's going to happen in the future and how am I going to be affected and what is going back to work going to look like possibly. And, you know, just we're here in the moment. That's all you can really do, and focusing on your surroundings and grounding yourself. Lexi will talk about that more. And then lastly, really taking care of your body during this time. It's a really stressful time on your body and your health. And so really basic things like eating well, exercising. And I would say reaching out to other people is also a way to care for yourself. Trying not, you know, to use substances or eat too many donuts, which is what I've been doing. You know, things like that. And lastly, I would say being compassionate with yourself is the most important thing. People have a lot of expectations of themselves right now and what they should be doing and how things should look. And just realizing that this is a very unprecedented, weird time, and whatever you're doing to cope, it's okay. And just being kind to yourself. So that's it for me. I'm gonna hand it over to Lexi.
Can I jump in with a couple questions? There was a couple things that you said that kind of piqued my interest, and I wanted to understand a little bit better. You said that it's very difficult in these very uncertain times for the mind to catastrophize. And so can you tell us a little bit about that and what the mind typically does and why it's different now? So that's one question. And I just want to remind people, if they have additional questions, to use the chat function. And my second question would be, a lot of us on the call are working with people, patients, family members who have lots of different issues going on. And so part of the mental health situation for ourselves is also how can we help others and our loved ones, maybe who might not be sheltering with us, get through this time as well.
Wonderful.
And the other thing that somebody just reminded me is, please don't discuss private or personal information on the health information of specific other people, since this will be recorded. Thank you for that reminder.
Yeah, so to address, so catastrophize, and Lexi can speak to this too, because she deals with this all the time, but essentially when our brains, when there is uncertainty, we don't know what's going to happen, people have the tendency to imagine the worst case scenario, or to kind of let their brains spiral out of control into, you know, what is the absolutely worst thing that can happen, and then imagine that that's going to be the case. So that's really catastrophizing, and we have very specific therapy to help with catastrophizing, and to help with what they call cognitive distortion. So, you know, imagining the worst case scenario, or when you read one good thing or when you read 100 good things and one bad thing, to focus on the one bad thing, things like that. So there's a specific therapy to help with those kinds of thoughts. In terms of helping loved ones, I forgot to mention this. Most therapists now are doing telepsychiatry, and there's been a lot of information online, good information about managing anxiety and depression in this time. So I know that there's a big resource list of trusted sources for this. Lexi will talk about cognitive therapy, which is very helpful. And then the telepsychiatry have also sent out some information. So therapists are doing therapy basically through Zoom or other platforms. What we're using at Swedish is encrypted so that everything will be confidential. People can't kind of hack into it or can't report it, or so that's what we're recommending, is that people reach out to therapists so that they can get some supportive and cognitive behavioral therapy during this time.
Are there specific suggestions for those experiencing abusive relationships or revisiting trauma, knowing that not everybody can get out of these relationships?
Yeah, that's an excellent question. And I'm going to that's something that Lexi knows more about. I'm going to let her address that.
Okay.
Yep.
That's great. So Lexi, why don't you jump in here and help us with some coping skills now that we have heard a little bit about the challenging times we're in.
Yeah. Well, thanks so much for having me. I wanted to start by just talking about what is a coping skill, right? Because I think we hear a lot about them in the, kind of in the world, but most of us have some coping skills already, right? Whether we call them that or not, we all have ways that we move through the world and handle sort of the ups and downs of our days. What's tricky about this time is that a lot of the coping skills that we've relied on in the past, maybe getting together for a walk with your neighbor, or going out for a nice meal, we can't access those coping skills anymore. And so what we're having to see is to cope in a different situation, and so that can be really challenging. I want to start out by saying that even though this event is happening to all of us globally, it's a unifying event, right? Everybody, literally no one can say they're unaffected by this. We're not all experiencing it with the same set of circumstances, right? And so to your point about trauma or an abusive relationship, or there are people for whom, I imagine on this call, there are people who are healthcare providers who are going in every day, who are personally getting exposed to COVID or worried that they're going to be exposed. They have family members who are worrying about them. Their livelihoods have changed dramatically in a short amount of time, where their businesses had to shutter, or they got laid off or furloughed. And so even though this is a universal experience of this quarantine or this pandemic, the individual is having their own set of circumstances. And I think it's important to name that, right? Because what I hear often from patients is, well, I feel depressed and I feel anxious and I feel cooped up and I feel bored and I feel isolated, but I really shouldn't feel that way because other people are having it way worse. And so what we call that is like invalid. So one of the most important things is just sort of to start by saying that however you feel right now is valid, right? This is a really difficult time, and it's okay to sort of name and acknowledge how you are feeling. And that's the first step. And that doesn't take away from, say, the gratitude you feel for having a secure job or having a house. It doesn't take away from it. You can feel both grateful and anxious simultaneously. And I think that's important to know. So name how you feel, know that it's valid, right? The next step is basically to say, okay, what are these coping skills? Which ones do I already have? And I really think about them, or we think about them in the therapy world, as adaptive and maladaptive. So Dr. Zantop referred to some of the ones that we consider pretty maladaptive, like abusing alcohol or overeating, or I see a lot of people engage in like numbing behaviors where they spend a ton of time on social media, or just kind of scrolling the internet or playing video games for hours and hours, eating the entire contents of your pantry out of anxiety, right? Those are what we consider maladaptive, right? Because they're just not serving you, right? Then there are adaptive coping mechanisms, things that we can do that we actually know are beneficial, that are good for us, that help us, and they don't cause us harm or anyone else harm. So what I'm going to be focusing on today is moving towards having what you could almost consider like an emotional first aid kit full of adaptive coping mechanisms. One of the first things that I like for people to think about is when Dr. Zantop was referring to that nervous system response to anxiety or stress, that is absolutely a good thing. We want to have anxiety. That's what prevents us from walking out into a street without looking both ways. It makes us wash our hands right now during this epidemic. It just makes us be cautious and make good choices. So we don't want to go to the point where we don't listen to our anxiety at all. We want to be able to listen to it, but we don't want it to be in charge all the time, right? So what I like to think about is when that anxiety gets set off, and that's a complex system in our brains. It involves the amygdala, which is that fight, flight, or freeze response. It gets set off and it sends all those stress hormones out into our body. We need to acknowledge them and say like, oh, wow, I'm really feeling a lot of tension in my shoulders, or I can feel my heart is racing, or I can feel that I'm like just really tensed up. I'm in that hyperarousal state. And say like, is there anything that I really need to be in this state for? Is there a saber-toothed tiger in my vicinity? No, there's not, right? What set off my anxiety? Oh, right, okay, I just listened to a news report and it really made me anxious. Or I went to the grocery store and the shelves were empty and it set off this anxiety response for me. Or I got on the call with somebody who was really in a panic and it just kind of set off my panic, right? So part of it is starting to be aware of how do I know when I'm anxious, and what are the triggers in my environment that are setting off that anxiety. So I really like to use a skill that's pretty easy to remember. It's called STOP, and it's an acronym for a set of things to do to check in with yourself. So the S is really easy to remember because the S is for stop. So you literally stop what you're doing. And a lot of us are trying to do 16 things at once, right? We're cooking and we're answering a call and we're doing a work project, and so we're getting kind of overwhelmed, a lot of sensory stimulation. So we literally stop what we're doing. And then the T is for take a breath. I think we really want to slow down our breathing for a whole minute, right? And the simplest way to remember to slow down your breath, and I use this with my kids, it's very easy to remember for grown-ups too, is to picture you have a bowl of soup in front of you, and you can say, I'm going to smell the soup, and I'm going to cool the soup. Right? So it forces you to go in through the nose, out through the mouth, and to really slow it down, right? It really slows down your breath. And I like for people to do that for a whole minute. Now, the reason why we do that is by breathing, we actually send a message to our brain that we are not in fight or flight anymore. If we're breathing that slowly, it actually kind of reverses that whole system, and it helps us bring our prefrontal cortex back online. This is the decision-making part of our brain. This is the part of our brain that helps us think about pros and cons and what's the consequences. This is the part of the brain that's really what we want to be using when we're making big decisions, right? So we're going to slow down our breath for a whole minute. There are a lot of other breathing techniques out there, and most people have one that they maybe learned in like a Lamaze class somewhere or somewhere else in a yoga class. They're all great. Anything that slows down your breath is great. I just really like the soup one because I can remember it even when I'm really anxious.
I think that's a great analogy. Easy, super easy to remember. And I also just wanted to pop in here and just say we will send STOP and other resources in a resource sheet following the call today. Because I'm receiving some additional resources from those who are on the call, it might take us an hour or two to get that out, and it will be posted on the WASHA website. And I do want to do a shout out also to Brad Lichtenstein, who's a naturopathic doctor at Bastyr and has the breath space. And I've been doing his twice weekly meditations, and they've been really great.
Great.
Anyway, stop.
Yeah. Yeah, no, that's great. So yeah, so we've done our stop. We've done our take a breath and slow down our breath. The O is for observe. So this is where we check in with our bodies and our surroundings, and we take stock. Often when we do this, we will realize, oh, I forgot to eat. I'm a little bit irritable because I didn't eat. We work with new moms a lot, so they often are kind of so busy they forget to eat, and then they're a little bit irritable, and then when they do stop, they're like, oh, I forgot to eat. Or I'm feeling really, really kind of amped up. I have a lot of energy. Or, oh gosh, there's that sound happening. My kid is playing with that toy and it's really driving me nuts, right? So we're sort of checking in with our whole body and then checking in with our external circumstances in a non-judgmental way. That's the observe piece. And finally, the P is for proceed mindfully. This is where we ask ourselves, what's the one next thing I need to do in this moment, right? I'm not going to solve the problems of the world. I'm not going to figure everything out, but I'm going to pick the one next thing I can do to improve this situation. So in the case where the person identified they were hungry, they can go in the kitchen and make themselves a nutritious snack. In the case where the noise was driving them crazy, maybe they move that kid and the toy to another room, or they put it on mute or whatever, right? So there's like one thing to do. And then if they're still feeling kind of amped up, you go through and you do stop again, right? It's just a way to identify how you're feeling and what's the one next thing you need to do. The other thing I wanted to mention and just echo what Dr. Zantop said about rituals and routines is, in this time when we're feeling so anxious, it's great to develop a daily routine that's pretty much a loose structure that you follow every day. So having it written out, I'm old school, so I write it out with paper and pen, but really having it be the same. You know, I get up in the morning, have my coffee, take the dog for a walk, check my work calendar, you know, like really keep it the same. We just really benefit, and we've lost a lot of our rituals and routines that we're not commuting every day, and we're not seeing our coworkers, and we're not getting those regular things that we normally did. So recreating rituals and routines that you can do during this time, it's beneficial for you individually and then also for kids. Kids are really needing those rituals and routines as well because they're so used to school and the rigidity and structure of school. And so it's really helpful for them to have predictable days, you know, so it's not changing every day. Lastly, I wanted to talk about this idea of the 4 M's, and this is easy mnemonic to remember of a way to maybe structure your day and to think about, okay, if I'm working these hours, how am I going to work these 4 M's into my day? So the 4 M's stand for mindfulness. So this mindfulness gets talked about a lot. It's out there in the world right now, but it's really the idea of bringing attention to the present moment. So some people really enjoy those meditations. Some people have a meditation practice that they're already doing. For some people, this is brand new. I really like the Calm, C-A-L-M app, which is on the resource list, and the Headspace app. They're both great for people who are just beginning this kind of mindfulness. They have 2-minute meditations, 5-minute meditations. Anything you can do to kind of work on being in the present moment and slowing down your breath is going to be great for anxiety. The second M is movement. Movement can be anything. I had somebody who was figuring out how to do flamenco dancing from her living room. You can do yoga. You can go for runs, you can go for walks, scooter rides. I'm seeing a lot of the neighborhood kids doing that. Anything you can do to move your body is going to help your body metabolize some of those stress hormones, and it's going to be really helpful for you to maintain just like your physical health through this. It's going to be really important. It should be something you like. I feel like that bears repeating because I keep hearing people being like, oh, I really should do this thing. I mean, if you don't like yoga, you don't need to make yourself do yoga. You know, find movement that feels good. Some people, their movement is actually just gardening. Gardening is actually really physical, so that's fine as well. The third M is for mastery. And that one's actually kind of a misnomer. You're not going to master anything, but anything you can find that feels like it's going to be a creative outlet for you. So I've seen a lot of people who are finding it fun to do some baking projects or cooking projects. I've seen people doing knitting or embroidery or trying, a new hobby at home, picking up that guitar.
Mask making.
Yeah, right, exactly. People are really getting creative and I love it, right? Like finding an instrument, dusting it off, trying it again. And the idea is actually not to try and master this hobby, but rather to give yourself something else for your brain to do. It's a meditative experience that can be really beneficial for you to not be in that hyperarousal state all day, right? So that's the third M, mastery. And the fourth one is meaningful connection. So even though we can't get together face to face the way we did, we are, as humans, are just wired for connection. We need each other. We are just totally meant to be with our people. So finding any way that you can to connect with others. And increasingly, the research is showing that for mood and anxiety disorders, that idea of a pro-social behavior, so behavior where you're helping someone else, seems to really help our mood. So the people who are sewing masks, perfect example, right? They're doing something meditative, that's their mastery, right? And then they're sending them off to the hospital. So it's a pro-social behavior, so they feel like they're helping, right? That's a great example. We've been over here getting into bread making. We've been making bread like you wouldn't believe.
We
so
have
we
too.
are making bread. But then I was like, oh, it's maladaptive for me to keep eating all this bread. So then I said, let me start handing these off to the neighbors with a little note. And so the kids have been drawing notes and we, go and deliver the bread outside of people's doors. So that's a pro-social behavior. Final thing is everybody's routine and ritual and emotional first aid kit is going to look a little bit different. So for some people, knitting is absolutely like their meditative mastery thing. Other people, knitting makes them feel crazy, right? Like it makes them feel like, I can't get this, it's not working for me. So don't be ashamed or upset if your coping style looks different from someone else's. It's okay. The idea is that you individually are taking stock of yourself and acknowledging what are the things I need to do to get through this time.
So, and I want to jump in here, Lexi, and we do have a specific question. There are a lot of people on the call who are health advocates or have senior parents. And do you have any specific ideas to implement with seniors who are confined to assisted living or nursing homes to help manage anxiety, boredom, fear? Often we're caregiving from afar. And so, and everybody's situation is different, but are there some specific things to help others cope?
Yeah, I think that's really hard, right? Because we know that isolation, even before COVID, was like a real risk factor for health, right? And so increasingly now, and obviously they're in a higher risk population, so they're extra worried, right? And so I think I love all the creative ways people are figuring out to make those connections. Obviously there's, Zoom calls and, the FaceTime, people are doing FaceTime and connecting with people. I've also seen lovely things where people are like going outside their window and like holding up signs for grandma and that kind of thing as well. I think it would be a nice thing to do to connect with that loved one and actually work with them to develop their emotional first aid kit as well. So help them look at their day, and say like, what's your day look like? What are your 4Ms? Like, tell me what's been working for you. It gets hard as somebody, with loved ones. I know sometimes I want to prescribe for them, like, try this thing will work. It works for me. Like, do this yoga video. Or I was talking to somebody the other day and they were like, my parents keep sending me seeds. They just really want me to, plant a garden. And I don't want to plant a garden right now. So getting out of that prescriptive mindset and instead taking this like sort of attitude of like, well, let me see how I can help you. Tell me what you are feeling. Don't, don't project what you're feeling onto them. You might feel lonely, but they might actually not feel lonely.
Right.
Kind of asking them, how are you feeling? What is going on? And then based on what they're describing, you can say, let's make a little plan. Let's make a little plan for your day. Like, would it be helpful if we talk twice a day, but for shorter? Would it be helpful if you got some movement? How can I talk to the people at your assisted living facility to help you get a little movement within the walls of the place? Because I think everyone understands that mental health is important too, and we don't obviously want to risk anyone's physical health, but since we are going to be in this for a long time, it's reasonable to want to make a plan for all those folks too.
So I'm receiving several questions either for you or for Dr. Zantop. One is, what about the role of medication? This comes from Vanessa at Bannister Advisors. How can people initiate the conversation with their primary care physician about working with them or engaging a psychiatrist for medication management during this time? I don't know, Veronika, if you maybe want to jump in on that one.
Okay, sorry, I just had to unmute myself.
Yeah.
Yeah, the role of medication is a really good question. And I think there's, for something that is so chronic and where there's so much stress currently, if your symptoms are causing what we call functional impairment, or really causing your symptoms to get to a level where you're not sleeping at all, where you're feeling so irritable that it's affecting your relationships, you're feeling so anxious that you're paralyzed, you're having pain, when things get to a certain level, it makes sense to consider medications and to have a discussion with either your primary medical doctor. And primary medical doctors do about 80% of prescribing of kind of basic medications for anxiety and depression. So your primary medical doctor is a great place to start. And they would probably recommend checking things like your thyroid to make sure that's okay, making sure that you're not anemic, just making sure that they're not missing anything first. The medications most commonly used for anxiety and depression are their serotonin reuptake inhibitors. So those are medications I'm sure you've heard of, like Paxil, Prozac, Zoloft. And those are used both for anxiety and for depression. They have a lot of rescue medications for anxiety, but those medications typically are only preferred for very short-term anxiety, or someone's having a panic attack every once in a while. So those are really not recommended long-term right now, though they're medications that are frequently prescribed. And those are medications like Xanax or Ativan. Those medications can cause, especially in elderly populations, an increased risk of falls, disinhibition, and can cause some rebound anxiety over time. So we really don't recommend using those kinds of medications.
And I think it actually, maybe not to actually get deeply into medications, because that'll probably be for people to get into with their own doctors. But I think in terms of either starting the conversation with a primary care physician and also suggesting someone had brought up about asking about self-harm alternatives. So if people are exhibiting new behaviors like cutting, giving examples about snapping a rubber band, that kind of thing. So for maybe parents who are experiencing that with their kids, especially, how do you engage in a conversation if that's something new that you haven't seen before?
Yeah, so I would encourage everyone who has a loved one who's experiencing anxiety to at least have a conversation about the risks and benefits of medications. Any good provider will not, just pull out a prescription pad and write a prescription, but will really try to figure out if medications are indicated or if there's other things that can be done first. In terms of cutting or self-harm behaviors, I'm going to let Lexi address that, because there's a kind of therapy that we do quite a bit in our center that's specific to self-harm behaviors. So I'm going to let you take that one, Lexi.
Sure. Yeah. So and self-harm behaviors are fairly common, and this is the kind of thing that I agree with Dr. Zantop. If they're if it's reaching that level, I would actually recommend that you reach out to a professional. So start with usually the primary care provider and just check in. And it's really important to assess for suicidality in those cases. And so you would want that to be something that your provider was aware of, and hopefully you'd get referred to a mental health professional who could do some teletherapy and do some interventions. Self-harm often, we look at that with through the lens of DBT, dialectical behavioral therapy. And so there's actually like a set of skills that we teach for people who are engaging in self-harm, and we help them develop ways to cope in a different way. It's a little bit more than I want to get into in this call, but it would be important that if that was going on, that you got that person connected with a provider who did have DBT training, who could kind of provide that person with some structured interventions to help them figure out what is leading to the self-harm, what are the triggers that are causing it, and then developing a set of skills to use instead. And I would want somebody, if it were me in that situation, I'd want somebody who would involve the whole family, because you're in quarantine together. So it's going to be important that the whole family's involved in that kind of care.
Someone also had suggested, Catherine North, that there's a EFT technique, emotional freedom technique, also known as tapping. Yeah. So is this something that people should know about, they should do on their own, investigate on their own?
EFT, I think it's actually kind of a controversial modality. And I'm not personally trained in EFT, so I can't speak to it specifically. That being said, I kind of take the approach that the tapping technique, I've seen it demonstrated, it doesn't hurt, and it's a very low intervention, and if it helps, then great. So if people wanted to kind of do their own research and look into it, some people really find it very helpful. It's not backed by the clinical trials and the other things. So and we're not trained in it. Yeah.
Gotcha. Somebody else recommended, Beth Burnett said that there's a mini mental status exam that can be used. It's available for people to kind of gauge whether or not they're depressed. Is that something that you recommend people do, or?
I'm not really familiar with specifically that one. Do you know, Dr. Zantop?
Yeah, I mean, there's a lot of screening tools for depression that they use actually in primary care. And so that would be something that if somebody presents to their primary care doctor, they would give you that screen. I know they're screening at all primary care clinics at Swedish, and that gives you a sense for how severe the mood or anxiety symptoms are. And there's a lot of different kinds of screens. I was going to say, Robin and everybody, if it's helpful, I'm happy to give you a handout on when to consider medications, kind of commonly asked questions about medications, questions that you should ask your provider about medications, kind of myths about medications, et cetera, and special considerations, if that would be helpful.
Sure. We're happy to send that along with our resource list that we will send at the end of our conversation today. Somebody also brought up the fact that with all the Zoom calls happening, that there's something called Zoom fatigue, and feeling like everybody has to connect through Zoom. So could you address that?
Yeah. I think so. I feel that being on therapy calls all day, and then, kind of getting to the end of the night, and then somebody wants to do a Zoom happy hour. And so I think it's okay to sort of say, I'm feeling a little bit overstimulated. Like, I adore my friends, but I don't know if I can do another video chat. And it's okay to say that. We use the terminology of nourishing versus depleting. And I really like that. Some activities are nourishing, and for some people, especially the extroverts amongst us, that connection is so key. And they're the extroverts are the ones who are organizing these happy hours, I'm finding, right? So
guilty.
Yeah, right. It's great, right? It's important, it's nourishing for you. But for those of us for whom using technology or being engaged in this way is really fatiguing or depleting, it's okay to say, I want to connect with you, but it's not going to be this way, right? Or what I said to my group of friends was like, I adore you guys. I'm going to participate every other week, right?
Mm-hmm.
So I'm not going to do it every single time they get together. And so it's okay to sort of note that some people's nourishing activities is depleting for you and vice versa.
And I'm finding too that as this thing is wearing on a little bit, that more variety, like not connecting only via Zoom, but I got a really good friend I hadn't talked to in a while who texted me, and I just picked up the phone and had a conversation with her instead of just texting back, because it feels like just the, I don't know, different ways to connect seem important during this time.
Yeah.
So we're not getting, our brains are not overtaxed with always trying to figure out what's happening through the video screen where you only have a certain amount of information,
Yeah.
So that's kind of tough. But so other questions, feel free to send them along during the chat function here, please. And I want to also just address the sandwich generation of folks that are having to deal with their own thoughts and feelings, their kids, their spouse, and their older parents at this time. So that's a lot for folks to take on. So how do you suggest that folks address that when you're caregiving not only yourself, your job, your kids, your spouse, all kind of at the same time and in the same physical space, it feels like? Any suggestions for that?
Yeah, I mean, I think that's been really interesting, is to watch people kind of have to wear all their different hats at the same time. And well, some people are experiencing this quarantine as a time of a lot of free time, and they're doing new hobbies and they're relaxing and watching a lot of Netflix. Others amongst us are really overwhelmed, right? Like kind of have too much on our plates and can't do it all, and are feeling really really trying to take care of too many things at the same time. And I think when we feel that overwhelm, a lot of times it can come out as irritability, right? And so we kind of lash out at somebody in our household, or we're not our kindest self, and it's okay to sort of acknowledge, like, no one was meant to do this. No one was meant to, teach how to multiply fractions at the same time that they're trying to, take a business call at the same time that they're trying to, connect with their doctor and find out about blah, 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 right? Like, this was never meant to be. And so what I've been advising people to do is to, first of all, acknowledge how you're feeling, acknowledge that this is an unreasonable expectation for anybody, and then figure out what can give, right? What are the standards that can give? So for instance, like allowing a little more screen time. If you are really strict about screen time with your little one, but getting 45 minutes in the morning to have your cup of coffee and recenter for the day helps you kind of go into your day in a better space, maybe that's a worthwhile trade-off, right? Or regarding, kind of your expectations for how clean your house is. Your house is getting used way more than it ever did, right? You're going through dishes and laundry and all these other things at a crazy rate, and it's getting dirtier. Maybe acknowledging, like, yeah, that makes sense, right? Like, I'm not going to be able to get to all that stuff the way I used to because we're using it more, and I'm trying to wear all these different hats at once. Mm-hmm. And all of this falls under the umbrella of something we call self-compassion. So self-compassion is really important as a tool to recognize, am I heaping expectations on myself that I would never heap on my friend or neighbor or loved one? And so one of the tools we use in CBT, which Dr. Zantop mentioned, is asking yourself the question of, like, would I talk in this voice to somebody I love? would I be this mean to my kid? Would I be like, God, why can't you do everything? No, I would never talk to somebody like that. So see how you're talking to yourself, and see if you can talk to yourself with a more self-compassionate voice.
Yeah, and I'm getting some comments from people who are feeling that the house is a disaster. I also wanted to just one other thing I wanted to make sure that we addressed before we wrap up in a few moments, which is people who are feeling the extremes. So for some of us, having family members maybe not even near us who might be having suicidal thoughts or something that's on the extreme that we haven't seen before. So how do you suggest we cope with that, or any resources for coping with that would be very helpful?
So regarding being worried about somebody who's suicidal, either who's in state or somewhere else. Yeah, and so I can only speak to Washington State, but I know that our crisis intervention services are still up and running. They're considered essential. So when there's somebody who's concerned about the welfare of somebody else in the state, we have a way of calling in that concern via the Crisis Connections website. You call and you talk to somebody, and if there really is a concern, the police can come out and do what's called a safety check, and they will send somebody out who is trained to assess for a mental health condition and determine if that person is safe to be home. And if not, we'll arrange for them to be admitted. So we treat suicidal thoughts very seriously, and certainly during this time with the increased isolation, the increased joblessness, the increased worry, it is a time when people who were maybe kind of doing okay are tipping over into more of a crisis state. So I would recommend that somebody who has that concern reach out and talk to the Crisis Connections version. And every state has something along those lines that could help you figure out how to get some help out to that person's house. Okay. Do you have anything to add to that, Dr. Zantop?
I was going to say, I agree with Lexi, and just to be clear, there's services for individuals, so they can actually call and get the support they need and be connected with mental health resources. And then there are also resources for families, so they can call the crisis clinic. And if they're concerned about a loved one, they can have the mental health professionals go and do an assessment to see whether that person could benefit from voluntary or involuntary psychiatric treatment at that point, and also connect them with resources, next day resources.
Thank you. So one last final question. Attitudes about the severity and length of this crisis go from it's being overblown to let's go back to normal immediately to this is going to go on for a year or more. Nearly everyone's going to get the virus. So how do experts recommend people navigate all the conflicting opinions and, you know, everybody conjecturing also individually about what's happening? Is there a good best practice model for how to address that?
I think that's a really good question. Again, what I would say is to really rely on the best sources of information and not to try to get overloaded, media overload. And then also, I think regardless of what the data is, this is a time of big emotions. And so there are going to be times when you feel completely overwhelmed and feel like this will never end. And then there's going to be times when you feel like, oh, you know, things are looking up, it might be better in a month. And I think just being able to ride those emotions and know that they're going to go up and down, that's very normal or very to be expected. I think that's important.
And Dale Reisner wanted to jump in and summarize too, which I think would be great to have your point of view, Dale.
Yeah, well, my comments that I was thinking of doing initially, I think are a good sum for this call. And they speak to not only mental health access, but other physical access. We've heard through this that people who are experiencing symptoms that would normally take them in for medical care are not seeking that care. We are really concerned about that. We're worried about conditions being worse by the time they actually do come in. And the one message you could spread, this is my opinion, but I think it's based on what I've seen. And that is, do not be afraid of the hospital. It's probably the safest place you can go. Everybody's masking, everybody's worried about not getting sick themselves. There's all kinds of protective equipment available. You will be given a mask at entry. If you are sick and need to be seen, please go. If you are pregnant and you're worried about coming to the hospital to have your baby, and we're planning on coming to the hospital in the first place, please come. We've had wonderful feedback from patients who had to come in and felt like they were really safe. So we're hearing reports of things going awry because people delay too long. And so just think about that. That goes for both mental health access and for other physical concerns.
Thanks. And we are out of time, so I'd like to wrap up. There are a couple people who have sent some additional questions that we won't be able to get to, but if you can send them to info@washa.org, I will try to follow up with our speakers today. And if you found this, this community conversation valuable today, I ask that you do the following. Please fill out our survey, which you should have in your inbox very shortly, and give us the gift of your feedback. We really want to hear what is resonating with you and who else you'd like to hear from. And join us next Monday as we discuss navigating cancer during COVID-19 with our special guest, Dr. Fred Applebaum, who's Executive VP at the Fred Hutchinson Cancer Research Center, and he's been called a cancer giant. He's really a pillar in our community. We'll be back doing another conversation next week at 11. Also, 3, please support WASHA. You can do that in several ways, but we'll be conducting our Give Big event next Tuesday. It's open for donations right now. If you are financially able, become a $50 supporting member of WASHA to help us run our organization. We know that not everybody can give at this time. So if you're not able to give, we'd love for you to join our community as a community-free membership. And all of this is available at our website, which is www.washa.org. Hope to see you next week. And thanks so much for joining you. Thank you so much, Dale, Veronika, and Lexi. We appreciate you and all the first responders, and so appreciate your time today.
Thank you.
Bye.
Bye.